Record.
Okay, hello everyone. Today's caregiver education and training will be on how to care for someone with diabetes. My name is Jasmine Morales and I'm a case manager for the Family Caregiver Support Program. Okay, next slide. Okay, and prior to continuing, I would like to introduce the rest of the team. We have Michelle McGuire, which is our program manager, and we have Olga, which is our other case manager. So a quick overview of what's going to be discussed today is first and foremost, what is diabetes? How to monitor diabetes, causes of high and low blood sugar, which is very important, treating low blood sugar, and how to support your loved one. Okay, next. So what is diabetes? Prior to learning how to care for someone with diabetes, it is very important to know what diabetes is. Sometimes there's a confusion about the different types of diabetes, and there's actually more than two, and what diabetes does to the body. So much of the food we eat is changed into glucose. And what is glucose? Glucose is basically sugar, which goes into our blood. We need this glucose for energy. Before our body can use glucose, the glucose must enter the cell. However, glucose cannot enter a cell without the help of insulin. And what insulin is, it's basically a hormone, and that's produced in the pancreas. Okay, so glucose fuels our body as much as gasoline fuels a car. The gasoline alone, however, is not enough to make the car run. So what else do we need? Olga, Michelle, any ideas of what else? What else does a car need other than gasoline?
Oil, tranny fluid, brake fluid.
Okay.
Electricity.
Okay. Well, the key. Without the key, you can't use the gasoline, right? So we need a key to turn the motor on, right? So only when the car is on, then the gasoline can be used. And this is the exact same way what happens with diabetes, the insulin and the glucose. Alrighty, next slide. Okay, so now today I'll be discussing, as I mentioned before, there is more than two types of diabetes, but today we will keep it short with type 1 and type 2 diabetes. So type 1 diabetes is insulin dependent. So this means that the person does not produce insulin and they must inject insulin every day. Now it could vary from person to person. Okay, now type 2 diabetes, majority of people may produce some insulin and be able to manage their diabetes with specific diet, with exercise, or oral medications. So insulin may or may not be needed with type 2 diabetes. Okay, next. Okay, now monitoring diabetes. So monitoring your loved one's glucose level is very important because it helps avoid further complications, such as eye complications, which can lead to glaucoma, cataracts, foot complications, such as neuropathy, which causes numbness in the feet, kidney disease, and heart disease that can lead to a heart attack and maybe even a stroke. So monitoring also gives you information to help manage your loved one's diabetes. Okay, next slide. Okay, now back with the car analogy. So not monitoring your loved one's diabetes is like driving a car without a gas gauge, right? So you really do not know if you'll need the gas, if you need the fuel, I'm sorry, to reach their destination. Or if they have overfilled the tank, then you may not know without monitoring it, right? So not knowing how high or low their blood sugar levels are can make diabetes management much more harder and lead to further complications, which we don't want, right? Okay, next slide. So now blood sugar levels. Now these numbers can vary. I think it's very important to talk to the doctor firsthand to see if these numbers apply. Again, every individual is different, but this is just a basic scale for blood sugar levels. So the goal for people with diabetes is to keep their blood sugar with a normal range. This can change throughout the day, right? Because one is consuming liquids and food, etc. So blood sugar at any time above 180 is considered high, too high. Now, what is acceptable before meals, blood glucose should be between 80 to 130. Again, these numbers can change. 2 hours after meals, blood sugar should be less than 180. And what is considered too low is below 70. And just a quick tip, I know strips can be expensive to monitor diabetes, so you can ask your loved one's doctor to prescribe them. The strips are covered by Medicare and Medicaid plans and most private insurance. So again, going back to the doctor. Okay, next slide. So causes of high blood sugar is food, what kind of diet you have, what kind of food you're consuming on a daily basis. Also, for some people, poor sleep or not enough sleep can increase blood sugar. And lastly, stress. Okay, next. So now causes of low blood sugar. So this includes increased exercise or physical activity, skipping meals, or meals that are more than 4 to 5 hours apart, or not having breakfast. So as you can see, it's important to consume food with the 4-hour period throughout the day. And then eating less food than usual, such as a portion size that is not enough, can also cause low blood sugar. Alcohol use, so especially on an empty stomach, if they take oral medications or insulin, this causes the body to release more insulin, which then lowers the blood sugar level. And then lastly, timing and dose of medication. So such as taking too much medication after a missed dose. Okay, next. So now signs of low blood sugar can include trembling, numbness or tingling, hunger, a pounding heart, sweating, a headache, irritability, sleepiness, blurred vision, or sometimes even difficulty speaking. Okay, next slide. So now how to treat low blood sugar. So now if this happens, well, first and foremost, you want to check, you want to monitor it, right? So if it's below 70, then you want to continue to the next step, which is to have a remedy or a sugary food in hand. So for your loved one, I would recommend in the purse, you know, if you do go out to the doctors or you go to the grocery and your loved one goes with you, to have like some sort of lifesaver with you, sugar, candy, this can be raisins, honey, so that if their blood sugar is low and they're experiencing the signs of low blood sugar, then you can quickly just have them take a little bit of that. Now you don't want to have them take the whole can of soda, right? Because then it's going to spike up and we don't want that. So it's recommended half a cup. Okay. Now then after that, you want to wait 15 minutes, note the symptoms, and then you want to recheck their blood sugar again. If you still see that it's low, then you want to continue the first and second step again. If you don't see that it's changed, then it's important to seek medical attention and call 911 as soon as possible. Okay, now next one. So now being supportive, help your loved ones stick to important lifestyle changes, and that includes diet. For example, exercise as well. It's important to understand that they may be going through a lot. It is not easy to avoid food, you know, especially when one used to enjoy a specific diet or a specific food that they were accustomed to, you know, something to consider that it is difficult. Also, make gradual changes together as a team. So working with your loved one as a team or your household, setting small goals such as taking a walk after dinner or trying a new healthy recipe. Again, this may be difficult, so you want to start with these changes gradually and then little by little implement them to the diet. And you don't want to play the food or exercise police, right? So again, gradual, start small. Then learn the basic care needs of people with diabetes, such as the medication, the blood sugar monitoring, and insulin, which is briefly explained earlier. Be patient. So allow your loved one time to process what can sometimes be overwhelming, the overwhelming of information and recommendations. Be patient with the extra time your loved one may need to read labels, such as carbohydrates or monitoring their blood glucose. It's also important to perform foot care. So I guess it all depends on where your loved one is with their diabetes. You don't want to trim their own nails. It's recommended to talk to the doctor to get a referral out to have someone clip their nails. Okay. And then third point is ask your loved one how you can be helpful. And you want to be specific about what you're able to help with. If your offer is refused, let your loved one know the door is open if and when they're ready. You don't want to offer help you're not willing to provide as well. And then the last point is to recognize your limitations. No one can be helpful if they're exhausted or overly stressed. One comes first before someone else. So look for support groups. We do have one, which is on Tuesdays and Thursdays, and you're more than welcome to join there. Okay, next slide. And a couple of resources, the American Diabetes Association, they have really good information in regards to diabetes if you want to learn more. Also, the Centers for Disease Control and Prevention, they have a Go for Life section where you can actually enroll and they'll email you brochures, or you can talk to one of the case managers on the Family Caregiver Support Group program, and then we can just mail that out to you. Also, the National Institute on Aging as well. Okay, and next slide. Alrighty, and thank you all for joining. Any questions that you may have? Team?
Oh, yeah, actually, Jasmine, thank you. That was really great. What are the other types of diabetes? I can't wait to hear. I just want to know. What are the other types? Can you tell us real quick?
Yeah, so I can't think of the term right now, but let's
Is it
look it up really
mono? Is
quick.
it something called mono something?
I know there's hypo,
Because
and then there's pre-diabetes as well.
there's
right?
there's a type of diabetes that, yeah, there's some strange type that you can be born with where it's called mono something.
Okay, I haven't heard of that one. I know there's a
Monoclonal.
hypo.
Okay. Well, it's okay.
Hyperglycemia is another
okay.
one. Yes.
And that's considered diabetes, hyperglycemia?
Yes.
It's like you have a high, like you don't, like your body's not doing it's not balancing out the insulin correctly.
Exactly.
The key is not fitting the lock correctly for the car.
We're having a lot of high blood sugar as well.
That's interesting. And then you also mentioned that there are foods that increase, types of foods will increase. And I know I've heard some about that, a little bit. I've heard that like carbohydrate foods will convert to sugar.
Exactly. Yeah. And once you start talking about diet, it can be a lot. And again, it all depends on the type of diabetes that you have. There is workshops that one can join, and it's like a series of like 6 classes because there's just so much information. But maybe it'd be good to consider having another training and education presentation on diet specifically for people with diabetes.
Yes.
Type 1 or type 2.
Yeah.
Yeah,
I know
even,
go ahead.
I've heard even like fruits, you know, like grapes, they have high concentration of sugar. Like you would think it's natural and it's healthy, but
Right.
you know, people with diabetes can't eat grapes or stuff like that. So yeah, it kind of depends on the individual and their needs.
Exactly. Like, for example, my mom, she says, well, fruits are good for you. So here's a whole bowl of strawberries, but they contain a lot of sugar. And that's what a lot of people don't know. You know, you grew up learning fruits and vegetables are important for one to consume, but it goes back to the portion. How much are you eating? And that's when it becomes even more important for people that have diabetes.
Yeah. And then, yeah, I can see how it would be totally individual. And I mean, even within that individualization, like customization to a person, it's going to vary day to day, right? Let's say you break your leg and there goes your activity level, right? So you're going to have to change all that. Or you take a trip somewhere on an airplane and you're stressed out and you're scared. That's going to, your sugar's going to go all over the place, right? So even if you tailor it for yourself, even it has to be so fluid. Yeah, I had a friend whose daughter was diagnosed with type 1 when she was like 1 year old, and it was traumatic for my friend and her husband, and it was traumatic. And they had to adjust, and the what they had to do with the daughter and having to poke her all the time. Oh, it was horrible. It took them a couple of years before they were able to manage it effectively, you know, and it's huge. So I really appreciate this presentation, and I hope you'll do more on this topic.
Of course.
Okay, was there anything else? I'll go ahead and stop recording.